What's up, y'all? I'm Alex Quin. This is Hustle Inspires Hustle. Today I'm with the Chief Strategy Officer of Mindbloom, Mike Petegorsky. What's up, man?
What's up, man? Great to meet you. Appreciate you having me here.
Super pumped. You guys are a dedicated team expanding access to science-backed mental health treatments, starting with guided ketamine therapy. And you guys have an exciting week this week. You got some updates for us. What's going on?
Yeah, man. This morning we announced the publication of our second clinical study, which is the largest in the history of ketamine therapy or any psychedelic medicine. It had data from over 11,000 Mindbloom clients and just continued to show that this at-home ketamine therapy program that we offer is remarkably effective as a treatment for depression and anxiety, fast acting. People are seeing results after 4 sessions and really safe. And so we're really fired up, man.
How long have you guys been in the market?
Mindbloom first started seeing clients in fall 2019, and that was with a clinic in Manhattan. But pretty quickly, COVID hit. And so in March 2020, the company went fully telehealth. And since then, we facilitated almost 500,000 at-home ketamine therapy sessions.
Jesus, everything is at home. Very easy to use,
Yeah, that's right.
very user-friendly.
Yeah, I mean, for context, ketamine therapy has been around for a bit. Ketamine was approved in 1970 by the FDA as an anesthetic and analgesic, so it was used in a lot of medical procedures. But in 2000, the first study was published showing how effective it is as a mental health treatment. And this happens with a lot of drugs. You approve it for one thing and then find out it's actually really helpful for something else too.
Yeah.
So there have been ketamine therapy providers, since shortly after that study came out, but the problem was access, right? It was $1,000 for a treatment. You had to do it in person with an IV, and there just weren't that many providers offering it. We do it through telehealth, which makes it more affordable, more accessible. You can do it from home. You don't have to live near your provider's office, and overcomes a lot of the privacy and stigma that prevent people from actually getting mental health treatment in the first place.
What do you think is one of the biggest misconceptions about the type of service that you guys provide?
I'll go with two. The first is if you read any article about ketamine therapy online, it'll start with like horse tranquilizer, also known as K, or one said super acid. I don't know who came up with that. It was like a Mad Lib, but there's this idea that it's this dangerous party drug or an animal drug or something else, and it's just not. I mean, well, let me put it differently. It is used in animals, so are tons of other drugs, but it's a human drug that was approved by the FDA for humans and is used every day. Every ambulance you see driving down the street has ketamine in it. Every ER has it, and it's got a remarkable effectiveness and safety profile. And as a mental health treatment, more than 100 studies have shown it's really effective, fast-acting treatment for mental health. So yes, it can be abused, and it is in some cases, but I think that really detracts from the fact that it is an incredibly powerful mental health tool in a world where a lot of the last generation treatments like SSRI, pills, and talk therapy aren't getting it done for a lot of people. And as kind of a related point, the other misconception, I think people wonder about this at-home model and this telehealth model. Can it really be safe? Can it really be effective? There have been more articles than I can count calling it the Wild West, ketamine therapy through telehealth. And, I think what our studies showed today is that when it's done right, it can be incredibly safe and incredibly effective for treating mental health. But, not all providers are created equal. I think, the reason our programs are successful is because we have clinical practice guidelines developed by the leading experts in psychiatry and ketamine therapy. We have these really comprehensive programs. It's not just the medicine, it's coaching, it's preparation work and integration afterwards to help you get more out of treatment. It's in-session audio, it's group integration sessions and community so you can meet other people going through treatment. And so there's this misconception that it's just the Wild West, or maybe it's just drive-through medicine, but nothing could be further from the truth. I mean, our providers are spending 7+ hours with each client, and we're seeing incredible results like you see in this study today.
Yeah, it seems like you guys focus a lot on user experience. You guys do have an app where you guys provide meditations and different kind of like guidelines for people to be able to follow with their treatment. Can you talk about that a little bit?
Yeah. So I think psychedelic medicine, well, it's been around for a long time in a lot of different forms, but I think ketamine therapy 1.0 was really just the medicine only. and in the early to mid 2000s, 2010s, if you got ketamine therapy, it probably meant you go to a doctor's office, they hook you up to an IV, and afterwards they send you home. And that was actually really effective. Believe it or not, most of the studies of ketamine have been done in that form, and they've shown it's incredibly effective for depression, anxiety, and other treatments. What we built with Mindbloom is really ketamine therapy 2.0, which is medicine plus coaching, content, and community. And so you go into the mobile app and you don't just take the medicine, you do preparation work beforehand. So you have meditations, exercises, intention setting, ways to actually get more out of treatment by going in with more intentionality. So in the psychedelic medicine space, people talk a lot about set and setting, meaning, your mindset going
Hmm.
into a session and your physical setting, what's around you. And so the app is really great for helping you get that mindset right and be in a space that's conducive to healing. And our guides are playing a big role in that too. Guides meet with clients on Zoom before the first session to help them prepare and get in the right set, get their setting correct, comfortable and conducive to healing. But then again, after the session, you get back in the app, you get journaling prompts. We have new AI tools to help people integrate it, because what we've seen is if you just take the medicine and go about your day afterwards, yeah, you'll probably get some benefit. But we think our programs are even more effective than that, because we're giving you these extra tools to help prepare beforehand and then integrate afterwards. And that's delivered through our app and through coaches who meet one-on-one and hold these group integration sessions where you can meet with other people going through treatment. And I love these. I was a client before I worked here. I went to integration sessions and groups, and it blew my mind. I mean, psychedelic medicine and ketamine therapy, if you haven't done it before, it's kind of like seeing a new color. There's not really a frame of reference or something to compare it to. It's not quite like being drunk or, some other substance. It's new. And I think so many people, myself included, when they go through that, they want to have people to talk about it with. Like, oh my God, you won't believe this experience I had and how it's changed my life. And we
Right.
have these group integration sessions for people to be able to share that.
So you mentioned that you were a client and you actually started working for the business. Can you share a little bit about your personal experience with these types of therapies and how they've influenced your career path and your role here at Mindbloom?
Yeah, I'd love to, man. And people, I think people are often curious what an actual ketamine therapy session is like. So I can tell you about my experience and actually like tell you a little bit about that first session and some of the experiences I've had, because I think for a lot of people, they hear about this and you're like, sounds cool, but special K or horse tranquilizer, I don't know,
I'm
what's
good.
this gonna be, right? And I get it, but like, part of what we're trying to do here is demystify this and help
Yeah.
tell people how this can actually help them in their lives. So for me, I've struggled with social anxiety that was pretty debilitating going back to high school. And, if I have friends hearing this, some of them are going to say, what, him? The truth is, like, a lot of people who have struggled with mental health stuff, I think I compensated it by building some skills to seem gregarious, to seem socially competent. But this anxiety has been brutal for me. I mean, it's a lot of it was around sweating for me. I'd get under pressure, I'd be in the spotlight, I'd feel some sweat on my forehead, I'd start getting nervous, my chest would get tight. I'd get that fight or flight response, right? And I'd be like, I got to get out of here. And Alex, I'm telling you, I walked out of job interviews, I walked out of dates, I walked out of my high school graduation. I used to be a litigator. I was in depositions with witnesses where I was asking them questions and I had to take 5 because I was sweating and freaked out that, the witness or the lawyers would see me and something would go wrong. And
Yeah.
it was, I tried therapy, didn't help. I went to a psychiatrist, a bunch of psychiatrists. They prescribed me Klonopin, which is kind of like Xanax, it's a
Yeah.
benzodiazepine, and beta blockers. And those could kind of help in the moment. Like I could take them before something and it would help me get through. But it was pretty brutal. I mean, with the Klonopin, it would make it so I wouldn't really form memories. And so I had this kind of Faustian bargain where it's like, all right, I can be pretty confident I'll get through this, but I probably won't remember it afterwards. Or I
Damn.
can try to go without it and maybe panic and have to run out. And I usually took the pill option and it let me get by, but it was a pretty rough bargain, man. I mean, there's gaps in my memory that I wish were there of important events in my life. And, I did this for a decade. So
What do
when
you, sorry, go ahead, go ahead, go ahead.
no, no, please.
I was going to ask you, like, there may be many people that are dealing with anxiety, but they don't know they have anxiety,
Yeah.
right? You guys, I'm sure get a lot of that.
Yeah.
Do you have any tips for like recognizing what anxiety is and maybe the difference between anxiety and depression or the link between both?
Yeah. Yeah. There's a great quote. I'm gonna say it's I'm gonna say it's from Mark Twain. It's probably the fact that I'm saying that means it's definitely not from him, but there's a quote that's along the lines of, "My life was a series of tragedies, only some of which came to pass." And that's kind of anxiety for me. I think about the future and things that could go wrong, and I suffer through these things that haven't actually happened and may never happen because I'm just spiraling in my head. I'm actually picturing myself uh, getting called out for being sweaty or weird on a date, or fumbling my words in a courtroom, or messing up a big presentation because I'm nervous and shaking. And so anxiety, I think about as often really being like fear. And for me, it was often experience of fear of something that might happen in the future. It was also characterized by rumination, spiraling. I would lie in bed at night and have these thought spirals of like, what if this happens? Oh, maybe you can do that about it. Well, what if that happens? And maybe that'll, and you kind of
Yeah.
keep going around. And for depression, I haven't personally experienced depression. So this is not speaking from experience, but my understanding of depression is often characterized by lack of feeling joy or pleasure or excitement about things, feeling stuck, feeling slow, feeling tired, feeling sad, and beyond just sad in the moment, sad as like the background noise and the filter through which your experiences have to pass. And friends
Mhm.
with depression have talked to me about being at a wedding, their team wins the championship, whatever it might be, and just not feeling any excitement or joy or happiness, like seeing these things happen and feeling nothing. And so I was always able to experience joy and happiness, but a lot of my life was characterized by fear. And it was heartbreaking because I had a great life. I knew that, but
Yeah.
this there's this interesting idea in Buddhism, Buddhist thought of, the obstacle is the way, or the obstacle
It's a
is the
great
path.
book. There's a
Yeah,
book called
exactly.
Obstacles
Right.
the Way. It's great.
Yeah. And I think with anxiety, there was part of me that was like, okay, the obstacle is the way, like the anxiety is the path through. I've got to conquer this. And then there was another part of me that was like, maybe this is my gut telling me that being a litigator is not the right career for me, or that dating's not for me, or something like that. And like, rather than fight through these things and suffer through anxiety, maybe should just quit. And that's a hard position to be in. You
Yeah.
have these things in your life that you want to do or achieve, and you have this thing telling you, don't do it, it's scary and you'll feel bad.
Yeah, man.
And so, and so when I got to ketamine therapy, I didn't know what to expect. But I meet with my clinician on Zoom. I get the diagnosis I expect, which is a generalized anxiety disorder. They issue a prescription of ketamine, which is delivered to my home. I meet with a guide. They kind of tell me what to expect a little bit. I get also delivered an eye mask, a journal, a blood pressure cuff and heart rate monitor, which you use before treatment to make sure those are in range to make it safe to take the ketamine. When you actually take the ketamine, with our protocol, you hold it under your tongue for about 7 minutes and then spit it out. And then you put your eye mask on and you just turn inward, and you have an audio track playing on the app. And the
Hmm.
audio, sometimes it's music, sometimes it's nature sounds. We offer guided programs where someone actually talks you through it. So there's choice there. I think
Right.
my first one was just nature sounds. And the closest way I can describe it is like noise canceling headphones for your brain.
Hmm.
All of that spiraling, all of that doubt, all those voices saying, look out for that, watch out for that, what if this happens, don't do that, all of that just quieted down. And my first session, I'm lying there with my eye mask on, and I have this experience of being in an igloo. It's cool, it's quiet, I'm alone, and there are these different doors. And each of these doors has a different experience that might have given me anxiety. Maybe it's a date, maybe it's public speaking, maybe it's a big, whatever work presentation. And I can go into those rooms and experience being in that setting, but without the physical sense of anxiety, the chest tightness, the sweating, the heart racing, and my thoughts aren't racing either. I'm just there, and I feel this total stillness and quiet in these situations that would normally set me off. And it's kind of this aha moment, like, oh, that trigger isn't a necessity. It's not always there. These thoughts and the physical sensation aren't inextricably linked. You can disaggregate them and you can say, just because I'm on the spotlight, just because I'm on stage, just because I'm on a date with someone I really want to impress, doesn't mean I have to have all those feelings and thoughts. And I can actually
Right.
just be in that moment, be still. And it showed me this space between stimulus and response, between action and reaction. And I got out of that session and I was like, I didn't know it could be like that. I actually didn't know that I could be in that setting and not feel those things. And with more sessions, I was able to really visualize that more, experience quietness, experience boundless awareness where I was aware, but I wasn't totally myself. I was just awareness. And it let me find this real stillness that then I could practice in life. And what the guide helped me with was prompting me, okay, maybe the next time this happens, can you find that little pause? Can you find that space between the stimulus and the response? And slowly over time, I was able to get past that. And I had the culmination of it really was I was speaking at a conference in a room with a few hundred people. And for something like that, for a decade, I would have taken a couple Klonopin, a couple beta blockers, and fought my way through it. But I was prompted, hey, by someone I work with, hey, do you want to try to do this one without the pills? And I was like, yeah, I think I'm ready. And I was in the tunnel. It was beforehand. It was kind of like you walk out. I felt like a startup lawyer version of a rock star. I'm like in the tunnel, ready to go out on stage, right? Believe me, I know I'm not a rock star. Uh, I'm standing there. It's like kind of hot. The air's a little close. I'm feeling a little sweat on my forehead. I'm like, oh, here it comes. But then I'm like, wait, what if there's space? What if it doesn't have to be that way? And I look around and I
You
notice
had the
that
other
the other people,
perspective. Yeah.
yeah, the
Yeah.
other people I'm on this panel with, I realize they're getting a little nervous too. I see a little sweat on their brow. I'm like, yeah, this is kind of the human
Yep.
condition. It's
Yep.
okay. It's not me. I'm not weird. I'm not a freak because I have these feelings. And just because I have these feelings doesn't mean I have to escalate all the way up.
Yep.
And we got on stage. There was a panel with me and a few other people. And I actually fumbled my first couple answers. I like stumbled over my words, which I don't usually do. And I had this moment of like, was this a huge mistake? Am I about to blow this? But I was able to keep myself calm. And, the most amazing thing was this woman I was on the panel with was the founder of an addiction treatment company, and she shared her own experience with addiction. And I was kind of inspired to do the same with my, anxiety struggle. And when a question came up that was relevant, I shared it, and it was so liberating to share that on stage in the moment. Like this is me conquering this stuff.
Yeah.
And I think it was because this ketamine therapy helped me see that it didn't have to be that way, that you can break bad habits, start good ones, and actually change your mind.
How long? I mean, I guess it's subjective, but how long do the treatments usually last? How does that work?
It's a great question. And it's one of the reasons I think ketamine therapy is such a great tool, not just for mental health, but for performance and for hustle. It's when you take the medicine, you're back at your baseline in about 90 minutes, sometimes less, maybe a little more in some cases. But you take the medicine, you usually have a pretty powerful experience for 30 to 60 minutes. Then you have the tail end of it while you're awake, you're journaling, maybe you're thinking about stuff still for another 30. And then by the time 2 hours are up, 90 minutes maybe, you're back to your baseline. And so I can do a ketamine therapy session, a Mindbloom session on a Wednesday, then eat dinner with my wife, play with my baby, and get back to my day. I mean, it's really something that fits into your schedule. And I think it's a really powerful tool, especially, for me, anxiety got in the way of work sometimes. It was hard for me to sit down and focus and not worry about all the things on my plate or the things I could do and just try to do one thing at a time.
Right.
So I use it, on a Sunday before a work week sometimes, or even in the middle of the week if things are getting crazy. And it just resets me. It lets me find that balance, clear out the cobwebs. Someone used this great analogy. I don't know if you ski or snowboard, but it's kind of like when there's a bunch of grooves in the snow, you've been going through those same grooves over and over, thinking the same thoughts, ruminating, spiraling. ketamine therapy is like a fresh coat of snow and lets you put down new tracks. And so when it comes to creativity and unlocking new ideas, ketamine therapy can be incredibly valuable for that and let you take a new path down the mountain.
I love that. I had never thought about that. Like a fresh snow, and now you could think a different way and not fall into the same traps you usually do.
Yeah. One of my core beliefs that really grew out of ketamine therapy for me is that it's never too late to do something differently. And I think ketamine therapy really helped me see that. I mean, you get so used to thinking the world has to be one way, right? I have to
Yeah.
answer my emails right away. I have to wake up and do this. I have to, you tell yourself these stories, right? That you have to do certain things. And I think what Mindbloom let me do was reassess some of those, get a different perspective and be like, it doesn't totally have to be that way. And, it unlocked an incredible level of focus and creativity for me by doing that.
How do you envision psychedelic therapies transforming the landscape of mental health care in the coming years?
Our vision at Mindbloom is to make psychedelic medicine the number one treatment for mental health. And I think the evidence shows that that's how they should be. Whether it's ketamine therapy, MDMA, psilocybin, there have been study after study showing that these treatments are remarkably effective for a number of mental health issues. And what makes them so incredible is that not only are they really effective, they're also really fast acting and safe. And so, taking ketamine therapy, or let's take MDMA, for example, because this is highly relevant. I don't know how much you've been paying attention to the FDA
I
news
haven't.
lately. Happy
Can you
to,
unpack MDMA for us?
yeah. So, MDMA was first synthesized in 1912, and it is, we think of it as a psychedelic. Some would call it an entactogen or an entheogen, but it's not a psychedelic in the same way as psilocybin or LSD in that, the cognitive experience is a little different, but people have this really intense experience often of like self-love, appreciation, understanding of their place in the world and community and gratitude. And it is undergoing trials, or the trials are complete. They've been submitted to FDA for FDA approval in the treatment of PTSD. And here's what's wild. There are currently about 13 million people in the US suffering from PTSD.
Mhm.
They're veterans, they're first responders, they're survivors of, sexual trauma, any number of issues. And the existing treatments just don't work that well. I mean, less than half of people that get these treatments get better, and the FDA hasn't approved a new treatment for PTSD in 25 years.
Hmm.
In contrast, in the trials of MDMA that are before the FDA, after only 3 treatment sessions, 87% of participants had clinically significant improvements in symptoms. 87%. I mean, that's unheard of. And it's after only
Wow.
3 sessions.
Yeah,
In contrast, the main pharmacological treatment for PTSD is usually SSRIs, which are an
yeah,
antidepressant. They take weeks or months to know if they're working at all, and they have some pretty brutal side effects. I mean, a
they
lot of
do.
people experience weight gain, sexual dysfunction, insomnia, and look, they've helped a lot of people, but there are about 40 million Americans on SSRIs, and we see this mental health crisis getting worse every year. I don't think these drugs are working well enough to say we don't need better options. And so with MDMA therapy, 87% is an insanely good number. And beyond that, after 3 treatments, 67% of patients no longer met the diagnosis for PTSD. I mean, they were cured. And right now, the FDA is deciding whether to approve that or not. And
Would that
they're
be an
expecting,
avenue you guys would look towards if it was approved by the FDA? It
if
would be
it's approved by
perfect
the
for you guys.
FDA, sorry, I missed
It
you
would
there.
almost be perfect for you guys because I mean, maybe not ketamine is not for everybody. Maybe somebody wants to try the MDMA treatment.
I
It would
think
be game changing. You guys would have the infrastructure.
I think you hit the nail on the head. I think our vision of the future is one in which providers can offer a different menu of treatment options that are individually suited for a patient. It's not a one size fits all. It shouldn't be that every patient is given the same thing all the time. I think, in the future, people will have not just an understanding of how well these works, but really an understanding of which ones are best suited for each patient. And we're really excited to help expand access to that treatment. The difference is I think for MDMA, the FDA is going to require it to be administered in brick and mortar facilities.
I figured, yeah.
And that's interesting because I think they're doing it out of concerns from safety or misuse. I think, it's tough. When I've reviewed the data, I haven't seen lots of, what I would think of as serious safety concerns, but I understand the FDA wanted to be conservative with the new psychedelic medicine. And if
Yeah,
that's what
maybe
they
it'll phase
do,
out later on and it'll get more lenient.
I think that's right. And, when it comes to brick and mortar facilities, it also offers us an incredible opportunity to deliver incredibly high quality care. So I talked a little bit about ketamine therapy 1.0, what was like you go in, you get an IV and you leave, right? I
Yeah.
think when we build facilities to deliver brick and mortar, MDMA therapy, we're going to be able to deliver an incredibly rich client experience where people are shepherded through the process with experts who know how to talk to them and support them throughout, get them in the right mindset beforehand, get back to baseline and reacclimate to the world afterwards. But this is going to be an incredibly powerful treatment. I think it's going to change mental health care, and psilocybin and LSD are on the way too. So the future is looking really bright, and we've been fortunate over the past few years to grow into the largest provider of ketamine therapy, and it's one of our top 3 strategic objectives to become the #1 provider of MDMA therapy too. So we're really excited for this rollout, and we're hoping the FDA approves it in August.
I'm gonna put my marketer hat on because I'm a growth partner, I'm a media buyer, and I'm curious because of the nature of the industry. Do you have any roadblocks when it comes to advertising to reach your patients because of the nature of the product? I've dealt with it in cannabis, I've dealt with it in CBD. There's always roadblocks with different industries, and you have to jump hoops sometimes to get to your people and be able to help the people that you're trying to help. How's that been?
Yeah, it's such a great question, Alex. And the answer is, yeah, it's hard. I mean, marketing in any healthcare situation is hard because there's a lot of regulatory scrutiny of medical claims. You
Yeah,
don't want to overpromise the effectiveness or something. You don't want to make claims you can't substantiate about safety. But on the flip side, when you do have evidence and you do have data, you have a First Amendment right to speak honestly and truthfully about, the treatments you're offering. And so, our task is to kind of thread a needle because there are so many misconceptions about ketamine, as you noted. There are so many, there's stigma attached to it. We want to be clear and educate people, but we also have to do so in a way that's responsible and doesn't overpromise this. But it's tough. I mean,
yeah,
from where we sit, we look at these 2 studies we've published, we look at the stories of our clients, and we're like, oh my God, this is so incredibly effective for so many people. It's transformed so many lives. I mean, I'd love to just tell my story to everyone, right? Because it was
yeah.
so life-changing for me. And it can be frustrating sometimes when it's like, for me, sitting here who lived this, can I tell my story in those terms, or would a regulator question whether I was being, going overboard and how effusively I talked about it? So you have to strike a balance between, presenting the evidence, being clear, but not overpromising or misstating the evidence.
Have the advertising platforms been friendly to the service, to the product?
Yeah, actually, they have. Facebook had a
Great to
really
hear.
interesting thing happen where they have what do they call it? The Meta has an oversight board now where I think after some of the election interference stuff, they basically said, we don't want to be tasked with saying what our platform will or won't allow, so we're going to have this independent oversight board give us recommendations.
Yeah,
And there was a case that came up about the ketamine therapy. It wasn't one of our ads, but someone spoke really effusively about their experience, kind of first person. But I think it was pretty out there. It was, I blasted into space and saw unicorns type stuff, right? And
yeah.
the oversight board basically said, we think maybe they shouldn't allow ketamine therapy ads regarding off-label use, or it was more about personal speech even than ads. But Meta said, actually, we disagree. This is a legitimate medical treatment, and it's important that people be able to discover
Got it.
truthful information about this.
Yep.
So we're not going to let people make false claims. We're not going to have people say things that are unsafe, but we are going to let people exercise free speech and talk about emerging mental health treatments, which I think was the right thing to do. I mean, for better or for worse, social media is where people discover a lot of information. And I think one of the big reasons we're in this mental health crisis is people don't know what's out there. People don't know what could help them, or they don't know where to get it. And so,
Well, honestly, a lot of people don't even know they have mental health issues.
yeah,
you,
yeah,
you don't know what you don't know.
yeah,
So it's good to hear other people talking about it, because
yeah,
some people may be experiencing anxiety and maybe they feel funky at one point in the day and they've learned to live with it and nobody's
yeah,
ever attached the label maybe to it. But
yeah,
other people's experiences is like, hey, well, maybe that sounds similar to what I'm dealing with.
yeah.
And the cool part is what you were talking about is the aspect of community, right? Like, for example, I use the Whoop Band community.
Nice.
I'm in marketing groups, community, mastermind groups, community. Community is very important because you get to learn from other people's mistakes, other people's triumphs, other people's
Yeah.
experiences. And it allows you to feel a little bit more comfortable, like you're not alone,
Totally. And I think you just hit on something that's so important, like not feeling like you're alone. Mental health can be a really isolating thing. And like you said, not everybody has the words to describe what they're going through or even knows that they could feel better.
Yeah.
And so I think a lot of what our job is to just reach out to people wherever they are and say, hey, you might be struggling, you might not have a name for it, but we have something that might be able to help. Come talk to our clinicians, see if it could help you. And one thought on that I think is really exciting that we've done in the past year or so. I talked about ketamine therapy 1.0 and us moving to 2.0, which is this comprehensive, coaching content community, really a wraparound process. We've recently moved into what I think is kind of the 3.0 of ketamine therapy, which is actually programs that are really tailored to more specific issues. And so beyond just depression or anxiety, we have programs now for things like getting unstuck or beating burnout. And you have to have a diagnosis of depression or anxiety or PTSD to get this treatment. But the programming is really built around issues that people might not think of as anxiety or depression. But I know there are people who are feeling burned out or stuck, or they've had grief or had rejection or failure, and it's hurting them. It's making their life harder. And we've got new programming and messaging around it, marketing around it to help people know that we can help with those issues too.
I'd love to hear that, man. Now, listen, I would love for you to walk me through the customer journey. Okay. I have no idea what Mindbloom is. I saw a Facebook ad. Okay. I'm interested. What does
Yeah.
the journey look like for me from that step all the way to me receiving the box and doing what I need to do?
Yeah. So it starts with a survey. We ask these threshold eligibility questions to see if treatment could be right for you. And, as I said, we require diagnosis of depression or anxiety. PTSD, we're launching just next week. So we ask some questions about symptoms you're experiencing just to understand if you're in the ballpark. Unfortunately, we can't offer it just for optimizing performance, for example. I think maybe that's in the future, but you do need to have a medical diagnosis to get treatment. So we start with some questions around that and also provide education. The survey is a mix of education and information and also questions to make sure you're meeting the threshold eligibility criteria. And that
Right.
also includes, age. We ask about certain pre-existing conditions, things like that. From there, you can sign up and schedule a consultation with a clinician. We find one who's licensed in your state, and these are psychiatrists, psychiatric nurse practitioners, and some physician assistants who have been trained in our protocols or overseen by our supervising physicians and are really experts in ketamine therapy. You get on Zoom with them, you have a consultation. Usually these run about 45 minutes, maybe an hour, and you get a full medical and psych eval. What are your symptoms? How long have you been experiencing them? What was your medical history, your family history? What medications are you taking? Really a comprehensive look at your mental and physical health to determine whether treatment is appropriate for you, because it's not for everyone. And it's heartbreaking, but unfortunately, we do have to turn some people away who might have a condition that makes treatment not right for them or might make our model not right for them. But we have a
Right.
pretty thorough screening process to make sure that we're always getting the right people, the right treatment. And if someone is a good candidate, and they agree to move forward, the clinician will issue a prescription. That prescription gets sent to an independent pharmacy who then delivers the medicine directly to the client. They also get delivered a Bloom box, which has an eye mask, journal, blood pressure and heart rate cuff, and some other tools to support treatment. That initial prescription is just a limited number of doses, between 1 and 3, depending on the client. And it's really to uh, make sure that we get the dose right and help the client kind of get acclimated to the treatment, make sure there are no issues or side effects that, again, might not make sense to continue. You also, in addition to a clinician, get assigned a guide, and you actually get to choose your guide, excuse me. You get to see guides who are really life coaches with expertise in different areas. You find a guide who has knowledge or experience that meets what you're looking for. Some people want a more spiritual journey. Some people want it to be more medical or clinical. Some people want more of coaching and kicking the ass. There are different ways it can look. So we have guides with different expertise. They reach out to you, and before that first session, you meet with your guide on Zoom to go over how to take the medicine, set your intentions, make sure your home environment's, set up right. And also you have someone who's called a peer treatment monitor, who's a trusted friend or adult, roommate, spouse, sibling, whatever it is, who's just there while you're getting treatment, really to make sure that everything's comfortable and easy. If the doorbell rings, they're there to get it. If you want to go to the bathroom, they can help you go there, but just somebody to kind of be with you during the treatment session. So your PTM and your guide get on Zoom, talk through it, get off Zoom, you do some journaling, probably set your intentions, take the medicine, hold it under your tongue for 7 minutes, spit it out. Eye mask goes on, audio is on, you turn inward. And it's not quite like meditating, but you are sort of creating this space where you're letting things arise. And it's interesting, when the medicine takes effect, you don't have to try to think about stuff. And we often say the intentions are, not a strict plan you have to follow. You kind of set them and forget them, and things will come up. And sometimes they're about the intentions you set. You might say, I really want to focus on, clearing my mind and, focusing on the task at hand when I'm at work. Maybe you have a session where you experience being at work and being at your desk and thinking about that. Or maybe you get something totally different. You don't have that control over it, but it's not something you cling to tightly. You kind of let it go and let the medicine do its thing.
Okay.
And about 90 minutes in, you're back to baseline. You journal after that first session. You get back on Zoom with your guide to talk through it and share your experience, share how it went. Also do a couple safety checks. And then you have other exercises and things you do in between sessions to really integrate the experience. We space the sessions about a week or two apart, depending on the person. And after between 1 and 3, you get back on for a follow-up consultation with your clinician to make sure there were no side effects or other issues, and to decide whether to issue the rest of the medicine. So an initial treatment program is 6 doses. They're spaced about a week or two apart. And, what this study showed is that they're really, really effective. I mean, just in those first 4 sessions, 62% of clients report significant improvements or depression and anxiety. And so really quickly, people are seeing great results.
Fairly quick. Yeah.
Yeah.
I love that. Let's talk about accessibility. Is
Yeah.
this part of the insurance pricing? How does that work? Or at least for now, I know pricing can change, but how are you looking now?
Yeah, no, it's a great question. Again, one of the benefits of telehealth is that it makes this treatment a lot more affordable and accessible. So before Mindbloom started, a ketamine therapy session was between $500 and $1,000 a session. Today, for a new client program, it's about $200 or less per session. And that price drops more for clients who can decide to continue treatment after that first 6-session package. And so the way we're structured, it's typically 3 payments, about $1,200 total. And it's not covered by insurance today, but we do give some clients who ask super bills that they can submit to insurance, and some insurance will cover the psychiatric consultations, which are a good chunk of that cost. I think in the future, you will see insurance coverage of this. I think that's actually going to get accelerated when MDMA therapy is approved by the FDA. The American Medical Association's actually issued a temporary CPT code for psychedelic therapy, which is eventually going to allow for reimbursement. So I think you're going to see more insurance coverage of these treatments really soon.
Hey man, you gave us a whole breakdown of this thing. I really appreciate it. This is super cool. I'm really excited to learn about it and see how you guys develop this thing.
I appreciate it, man. I mean, look, it's really exciting to be in this space. We're seeing so many people helped by this treatment. We've got a ways to go, but with MDMA therapy on the horizon, psilocybin coming after, the future for psychedelic medicine is really bright.
Where can we connect with you?
Mindbloom.com is the company. I'm on LinkedIn, Mike Petegorsky, but come to Mindbloom, check out what we've got to offer, read about our programs. We've got some really exciting stuff that can help a lot of people.
Lastly, how do you want to be remembered?
Me personally or Mindbloom?
You.
Me? I want to be remembered as someone who truly loved his family and his friends and squeezed every drop of fun out of life that he possibly could.
I like that. Family and friends is important, and giving yourself the permission to have fun is even more important because you got to be in good state of mind to be able to enjoy time with everybody. So pretty
No
cool
question.
stuff. Michael, I really appreciate you, man. This is super cool.
Hey, Alex, this has been a pleasure. I'm really grateful for the opportunity. It was real awesome jamming with you today.
All right, y'all. This is Alex Quin, Chief Strategy Officer of Mindbloom, Mike Petegorsky. See you on the next episode.